Stuff you should probably know, sooner rather than later. For further information and lead, look in the description below. Which medication would you choose to prevent heart attacks or strokes, or improve all-cause mortality in people with chronic arterial systemic hypertension? Chlorthalidone or hydrochlorothiazide? From here forward, I will refer to hypertension as CASH, going forward. In a paper published in the Open Journal of the American Medical Association in May 2024, researchers compared two thiazide medications and their ability to decrease acute coronary syndromes, strokes, or non-cancer deaths in patients with CASH. Could one of these two meds tip the scale in your favor? In the study, researchers compared two drugs, chlorthalidone, 12.5 mg, and hydrochlorothiazide, 25 mg, for CASH treatment. The stakes? Lowering the risk of recurrent cardiovascular events. Some basics. The study, published in May 2024, involved 72 United States VA medical centers from June 2016 to June 2021 that included over 13,000 participants over the age of 65. With CASH. Note, 98% were male participants. Primary outcomes were the composite of stroke, MI, urgent coronary revascularization because of unstable angina, acute heart failure hospitalization, or non-cancer death. Some of the results were a mean study duration of 2.4 years. The mean age of the participants was 72 years, with a range of 69 to 76. Less than 2% were women. Blacks accounted for about 14 to 18%, and Hispanics about 3.5 to 4.2%. The group mean BMI was 30 to 31, with a range of 27 to 35. Number of CASH medications was 2 to 4. The second most common medications were ACE inhibitors and angiotensin receptor blockers. About 22 to 32% were smokers. The results were positive, showing benefit of chlorthalidone in those participants with history of prior vascular events. Some of my calculations of the number need to treat were, in patients with history of MI or stroke, the number needed to treat for the primary outcome was 19.6, in favor of chlorthalidone. And a number needed to treat of 33.3 for all-cause mortality, also in favor of chlorthalidone. The results were compelling. For those with a history of heart events, chlorthalidone may offer a beacon of hope, potentially reducing major adverse cardiovascular events and non-cancer deaths. Of note, without an increase in cost, as chlorthalidone is also a very inexpensive medication, here take 3 seconds to like and subscribe. With these results, would you consider using chlorthalidone on your patients with CASH and a history of CAD and/or stroke? Thank you.